Hi everyone, my name is Roswell Timmerman, and today our group will be presenting on expanding mobile health units to improve healthcare access for uninsured populations. This presentation focuses on how mobile healthcare delivery can help reduce disparities and improve public health outcomes, particularly for underserved communities. Before we go further, it's important to understand why healthcare access is such a critical issue. Access to healthcare directly impacts health outcomes. When individuals are unable to receive timely care, even minor health issues can develop into more serious conditions. This not only affects individuals, but also increases strain on the healthcare system, especially when people rely on emergency services for conditions that could have been treated earlier. Limited healthcare access has significant consequences at both the individual and population level. When care is delayed, chronic conditions such as diabetes and hypertension can worsen over time, leading to more severe complications. This also results in higher long-term healthcare costs as treatment becomes more complex and resource intensive. At the population level, these patterns contribute to broader public health challenges and increased health disparities. Preventative care plays a key role in reducing these negative outcomes. Services such as screenings, vaccinations, and routine checkups help detect and manage conditions early. However, uninsured populations often have limited access to these services, which leads to delayed diagnoses and worse health outcomes. Expanding access to preventative care is therefore essential for improving both individual and public health. Healthcare access remains a significant challenge in the United States, especially for uninsured populations. Millions of Americans still lack health insurance, which often leads them to delay or completely avoid seeking medical care. As a result, preventable conditions can worsen over time, increasing both individual health risks and broader public health concerns. These disparities became even more apparent during the COVID-19 pandemic, where gaps in access contributed to unequal health outcomes across different populations.
Following that introduction, this case study focuses on a community health center that proposed implementing a mobile health unit. A community health center in an underserved urban area recognized that thousands of uninsured residents had no meaningful access to even basic preventative services due to barriers such as cost, transportation, and limited access to providers. Their response was to propose a mobile health van, which was a unit that can go directly into high-need neighborhoods rather than waiting for patients to come to them. This case is powerful because it shows us both the potential of community-driven health initiatives and the very real policy obstacles that stand in the way. By bringing healthcare services directly into the community, the program aimed to address gaps in access and improve overall health outcomes. So, who exactly was this program designed to reach? We're talking about uninsured adults who have no established primary care provider, and we're talking about low-income residents in neighborhoods where the nearest clinic may be miles away or require transportation that many people simply don't have. The proposed mobile health unit was designed to deliver several key services directly to the community, which included COVID-19 testing and vaccinations. In addition, the program included preventative health screenings and chronic disease monitoring, both of which are critical for early detection and long-term health management. By offering these services in a mobile format, the program aimed to reduce barriers and improve access to essential care. Despite the potential benefits of this program, The proposal also faced several important challenges. One major issue was limited public health funding, which required decision makers to prioritize between competing needs. There was also concerns about transparency in how funding decisions were made, which can reduce trust among stakeholders. Additionally, there was limited involvement from key community stakeholders, which made it more difficult to ensure that the program fully addressed community needs. These challenges highlight the importance of ethical leadership and collaboration in public health policy, and bringing care into community was the right response for these realities.
Uninsured individuals face several major barriers when trying to access health care. First, they have high out-of-pocket costs, which discourage many people from seeking care unless absolutely necessary. In addition, they often have limited access to preventative services, which are critical for early detection and treatment of disease. Many uninsured individuals also lack a consistent primary care provider, which leads to delayed diagnoses and fragmented care. Together, these factors contribute to worsening health outcomes and reinforce existing health disparities. These healthcare disparities are closely tied to broader social determinants of health. For example, income plays a major role, as individuals with lower income are less likely to have health insurance. Transportation barriers can also limit access to healthcare facilities, especially in underserved or rural areas. Health literacy is another important factor, as individuals may not be fully aware of the available preventative services or how to navigate the healthcare system. Finally, limited access to consistent primary care increases the likelihood of unmanaged health conditions. Overall, these social and structural factors significantly impact healthcare access and outcomes. Next, we'll look at a case study that highlights how these challenges can be addressed through mobile health interventions.
Now let's dive deeper into what was actually proposed. The Community Health Center's plan was to deploy a mobile health van offering COVID-19 testing, vaccinations, preventative screenings, and chronic disease monitoring. The goal was direct: improve healthcare access for underserved populations who were otherwise falling through the cracks. However, this is where the policy gets complicated. The funding process raised serious concerns, and there was a lack of transparency in how decisions were being made. The key stakeholders were not brought into conversation, and the tension is at the heart of what we're analyzing today. This case highlights several interconnected policy challenges. First, there's the reality of limited public health funding. There simply isn't enough money to meet every need, which means decisions have to be made about what gets prioritized. Second, communities have competing priorities, and without a clear and transparent process, trust erodes quickly. The lack of transparency in decision-making here is particularly important, as public health initiatives depend on community buy-in, and when stakeholders feel excluded, programs can fail even before they launch. Effective public health policy requires ethical leadership and genuine collaboration, not just the idea of it. Despite the implementation challenges in this case, the evidence for mobile health units is strong. Research demonstrates that mobile clinics are effective at reducing access barriers, specifically because they meet people where they are, delivering care directly into underserved communities. They reduce transportation barriers, expand preventative care access, and allow for culturally responsive outreach that builds trust over time. It's not an experimental concept, but it's a proven model that works when properly resourced and supported. Finally, we have to ask, what happens if we don't act? The consequences of failing to address these access barriers are serious and well documented. We see increased chronic disease burden, higher mortality rates among disadvantaged populations, and ballooning healthcare costs over time because, as we know, untreated conditions become expensive emergencies. Most importantly, inaction widens the socioeconomic health disparities that already exist. As research has found, these inequalities have measurable life-shortening consequences. Expanding healthcare access isn't just the ethical choice, it's the cost-effective one as well.
Our proposal focuses on improving healthcare access through several key strategies. These include expanding mobile health clinics, increasing funding for community health programs, and improving outreach to uninsured populations. We also emphasize strengthening partnerships between healthcare organizations to support more equitable care. Public health agencies can take several steps to address these issues. This includes increasing funding for mobile health programs and supporting partnerships between community organizations. It should also expand preventative services in underserved communities and promote policies that reduce healthcare disparities. These actions can significantly improve access to care. In conclusion, healthcare disparities among uninsured populations remain a major public health challenge. Mobile health clinics offer an effective solution by improving access to care, reducing disparities, and delivering preventative services. Investing in these programs can strengthen community health systems and lead to better overall health outcomes.
Now that we've heard both the case study and the proposed strategies, we can start to connect these key ideas. The barriers we discussed earlier, such as cost, transportation, and limited access to preventative care, are directly addressed by mobile health initiatives. The case study shows that these solutions are not just theoretical, but can be successfully implemented in real-world settings. At the same time, the policy strategies outlined demonstrate how these programs can be expanded through funding, partnerships, and public health support. Together, these elements highlight a clear path forward for improving healthcare access. Overall, expanding mobile health units represents a practical and impactful solution to one of the most persistent challenges in public health. By bringing healthcare services directly into underserved communities, we can reduce disparities, improve preventative care, and support better long-term health outcomes. These efforts not only benefit individuals, but also strengthen the healthcare system as a whole. As we continue to address gaps in healthcare access, mobile health programs will play an essential role in creating a more equitable and effective system. Thank you for your time. Before we conclude, I want to briefly highlight some of the key sources that informed our presentation. We relied on data from organizations such as the Centers for Disease Control and Prevention and the Kaiser Family Foundation to better understand healthcare access and disparities among uninsured populations. We also drew from research examining socioeconomic disparities in healthcare access and their impact on health outcomes, which helped support the importance of addressing these issues at both the individual and population level. In addition, reports from the Health Resources and Service Administration and the U.S. Department of Health and Human Services provided insight into the effectiveness and growth of community-based and mobile health programs. Finally, guidance from the World Health Organization and the national academies helped frame our understanding of health equity and the importance of community-centered approaches to care. Together, these sources reinforce the need for continued investment in mobile health initiatives as a strategy to improve access and reduce disparities.